41. A nurse is assessing a patient with COPD. Which finding indicates a potential infection triggering an exacerbation? A. Clear sputum production. B. Yellow-green sputum production. C. Oxygen saturation of 90%. D. Respiratory rate of 18 breaths per minute. Answer: B. Yellow-green sputum production. Rationale: yellow-green sputum suggests a bacterial infection, a common trigger for COPD exacerbations. Option A, clear sputum, is typical in stable COPD and less indicative of infection. Option C, 90% saturation, is within the target range for COPD and not specific to infection. Option D, respiratory rate of 18, is normal and not necessarily indicative of infection. 42. A patient with COPD is prescribed supplemental oxygen at 2 liters per minute. What is the nurse's priority assessment? A. Blood pressure changes. B. Respiratory rate and pattern. C. Skin color and temperature. D. Urine output. Answer: B. Respiratory rate and pattern. Rationale: monitoring respiratory rate and pattern is the priority to assess for oxygen effectiveness and detect CO2 retention, which can occur in COPD patients with excessive oxygen. Option A, blood pressure, is less directly related. Option C, skin color, is secondary to respiratory status. Option D, urine output, is unrelated to immediate oxygen therapy effects. 43. The nurse is teaching a patient with COPD about diaphragmatic breathing. What is the primary benefit of this technique? A. Increases mucus clearance. B. Improves oxygen saturation. C. Reduces work of breathing. D. Prevents lung infections. Answer: C. Reduces work of breathing. Rationale: diaphragmatic breathing strengthens the diaphragm, improving efficiency and reducing the energy required for breathing in COPD patients. Option A is incorrect as mucus clearance relies more on coughing techniques. Option B may occur indirectly, but is not the primary goal. Option D is unrelated, as breathing exercises don't directly prevent infections. 44. A patient with COPD reports feeling anxious during dyspnea episodes. What is the nurse's best intervention? A. Administer a sedative immediately. B. Teach relaxation techniques. C. Increase oxygen flow to 6 liters per minute. D. Encourage rapid breathing exercises. Answer: B. Teach relaxation techniques. Rationale: relaxation techniques, such as guided imagery or slow breathing, help reduce anxiety, which can worsen dyspnea. Option A, sedative, risks respiratory depression and requires a prescription. Option C is unsafe without medical orders, as high oxygen may cause CO2 retention. Option D may increase dyspnea and anxiety. 45. Which laboratory results should the nurse report immediately for a patient with COPD? A. PaCO2 of 65 millimeters of mercury. B. Hemoglobin of 13G/dl. C. Potassium of 4.0 milliequivalent/L. D. Glucose of 100 milligrams per deciliter. Answer: A. PaCO2 of 65 millimeters of mercury. Rationale: a PaCO2 of 65 millimeters of mercury indicates hypercapnia, a sign of worsening respiratory failure in COPD, requiring urgent intervention. Option B, hemoglobin, is normal. Option C, potassium, is normal. Option D, glucose, is normal and not immediately concerning. 46. The nurse is planning care for a patient with COPD. Which goal is most appropriate for nutritional status? A. Gain 10 pounds in 1 month. B. Maintain stable body weight. C. Reduce calorie intake by 500 daily. D. Eliminate all dietary fats. Answer: B. Maintain stable body weight. Rationale: maintaining stable body weight is realistic for COPD patients, as weight loss from increased metabolic demand is common, and obesity can worsen dyspnea. Option A is unrealistic and may strain breathing. Option C risks malnutrition. Option D is unnecessary and may reduce energy availability. 47. A patient with COPD is prescribed ipratropium. What should the nurse include in patient teaching? A. Use it every 4 hours for acute dyspnea. B. Take it regularly to prevent bronchospasm. C. Expect a dry cough as a side effect. D. Stop using it if heart rate increases. Answer. B. Take it regularly to prevent bronchospasm. Rationale. Ipratropium, a short-acting anticholinergic, is used regularly, e.g., every 6 hours, to prevent bronchospasm, not as a rescue inhaler. Option A is incorrect as albuterol is used for acute dyspnea. Option C is incorrect. Dry mouth, not cough, is a common side effect. Option D is incorrect unless severe tachycardia occurs, which requires medical evaluation. 48. Which environmental factor should the nurse advise a patient with COPD to avoid? A. High humidity. B. Air conditioning. C. Dust and pet dander. D. Bright lighting. Answer. C. Dust and pet dander. Rationale. Dust and pet dander are irritants that can trigger bronchospasm and exacerbate COPD symptoms. Option A, high humidity, may help thin mucus. Option B, air conditioning, can reduce allergens if filtered. Option D, bright lighting, is unrelated to COPD. 49. A patient with COPD is receiving non-invasive positive pressure ventilation, NIPPV. What is the nurse's priority action? A. Check the mask fit for leaks. B. Increase sedation to ensure compliance. C. Reduce oxygen concentration. D. Encourage frequent eating. Answer. A. Check the mask fit for leaks. Rationale. A proper mask fit prevents leaks, ensuring effective ventilation and oxygenation in NIPPV. Option B is incorrect as sedation is avoided to maintain respiratory drive. Option C is unsafe, without medical orders. Option D is impractical during NIPPV and risks aspiration. 50. The nurse is educating a patient with COPD about exercise. Which statement indicates understanding? A. I'll jog daily to improve my lungs. B. I'll stop exercising if I feel tired. C. I'll start with short walks and rest as needed. D. I don't need exercise since I use oxygen. Answer. C. I'll start with short walks and rest as needed. Rationale. Short walks with rest periods are safe and effective for building endurance in COPD without causing excessive dyspnea. Option A, jogging, is too intense. Option B may limit benefits if stopping prematurely. Option D is incorrect as exercise improves respiratory muscle strength, complementing oxygen therapy. 51. A patient with COPD has a new prescription for theophylline. What should the nurse monitor? A. Serum drug levels. B. Blood glucose levels. C. Urine output. D. Skin integrity. Answer. A. Serum drug levels. Rationale. Theophylline has a narrow therapeutic range, requiring monitoring of serum levels to prevent toxicity, e.g., nausea, seizures. Option B, glucose, is unrelated. Option C, urine output, is not directly affected. Option D, skin integrity, is not a primary concern with theophylline. 52. The nurse observes a patient with COPD using an inhaler incorrectly. What is the most common error? A. Holding breath too long after inhalation. B. Not shaking the inhaler before use. C. Inhaling too slowly and deeply. D. Rinsing the mouth before use. Answer. B. Not shaking the inhaler before use. Rationale. Failing to shake the inhaler for metered-dose inhalers prevents proper mixing of medication, reducing effectiveness. Option A is incorrect as holding breath briefly is correct. Option C is incorrect as slow, deep inhalation is proper technique. Option D is incorrect as rinsing applies post-use for corticosteroids. 53. A patient with COPD reports chest tightness. What is the nurse's first action? A. Administer a loop diuretic. B. Assess respiratory status. C. Elevate the head of the bed. D. Provide a high-calorie snack. Answer. B. Assess respiratory status. Rationale. Chest tightness may indicate bronchospasm or exacerbation, requiring immediate respiratory assessment, e.g., breath sounds, Oxygen saturation. Option A, diuretic, is irrelevant unless heart failure is confirmed. Option C may help but is secondary to assessment. Option D is unrelated to acute symptoms. 54. Which instruction should the nurse give a patient with COPD to prevent respiratory infections? A. Avoid handwashing to maintain skin oils. B. Get a pneumococcal vaccine. C. Limit contact with family members. D. Use a humidifier only in summer. Answer. B. Get a pneumococcal vaccine. Rationale. The pneumococcal vaccine reduces the risk of pneumonia, a common cause of COPD exacerbations. Option A is incorrect as handwashing prevents infections. Option C is impractical and unnecessary. Option D is incorrect as humidifiers can help year-round to thin mucus. 55. A patient with COPD is hypoxic despite oxygen therapy. What should the nurse suspect? A. Inadequate oxygen flow rate. B. Normal response to COPD. C. Allergic reaction to oxygen. D. Anxiety causing hyperventilation. Answer. A. Inadequate oxygen flow rate. Rationale. Persistent hypoxia suggests the oxygen flow rate may be too low to meet the patient's needs, requiring adjustment. Option B is incorrect as hypoxia should improve with proper therapy. Option C is not a recognized condition. Option D is unlikely as hyperventilation typically lowers CO2, not oxygen. 56. The nurse is discussing end-of-life care with a patient with advanced COPD. Which statement reflects a palliative care goal? A. Cure the disease with aggressive treatment. B. Maximize comfort and symptom control. C. Focus only on life-prolonging measures. D. Avoid all medications to simplify care. Answer. B. Maximize comfort and symptom control. Rationale. Palliative care in advanced COPD prioritizes symptom relief, e.g., dyspnea, anxiety, and quality of life, not cure. Option A is unrealistic as COPD is incurable. Option C opposes palliative principles. Option D is incorrect as medications are used to manage symptoms. 57. A patient with COPD asks about using a nebulizer. What is the nurse's best response? A. Nebulizers are only for hospital use. B. They deliver medication as a mist for easier inhalation. C. They replace all other inhalers permanently. D. They're less effective than meter-dose inhalers. Answer. B. They deliver medication as a mist for easier inhalation. Rationale. Nebulizers convert medication into a mist, aiding patients who struggle with inhaler coordination. Option A is incorrect as nebulizers are used at home. Option C is incorrect as they complement, not replace, other devices. Option D is incorrect. Nebulizers are equally effective for some patients. 58. Which finding in a patient with COPD suggests dehydration? A. Moist mucous membranes. B. Increased urine output. C. Dry skin and poor turgor. D. Weight gain of 2 pounds. Answer. C. Dry skin and poor turgor. Rationale. Dry skin and poor turgor indicate dehydration, which can thicken mucus and worsen COPD symptoms. Option A, moist membranes, suggests hydration. Option B, increased urine output, is normal or indicates overhydration. Option D, weight gain, may suggest fluid retention, not dehydration. 59. The nurse is caring for a patient with COPD during an exacerbation. Which intervention should be implemented first? A. Start intravenous fluids. B. Administer a short-acting bronchodilator. C. Order a chest X-ray. D. Teach relaxation techniques. Answer. B. Administer a short-acting bronchodilator. Rationale. A short-acting bronchodilator, e.g., albuterol, is the first-line treatment to relieve acute bronchospasm during a COPD exacerbation. Option A, fluids, is supportive but not urgent. Option C, X-ray, is diagnostic, not immediate. Option D may help anxiety but doesn't address airway obstruction. 60. A patient with COPD says, "I don't want to be a burden." What is the nurse's best response? A. You're not a burden. Let's talk about your concerns. B. Everyone feels that way, don't worry. C. Focus on getting better instead. D. Your family can handle everything. Answer. A. You're not a burden. Let's talk about your concerns. Rationale. Acknowledging the patient's feelings and encouraging discussion promotes emotional support and trust, aligning with patient-centered care. Option B dismisses the concern. Option C ignores emotional needs. Option D assumes family capacity and avoids addressing the patient's worry. 61. A nurse is assessing a patient with COPD. Which finding suggests an acute exacerbation? A. Stable oxygen saturation of 90%. B. New onset confusion. C. Chronic dry cough. D. Barrel chest appearance. Answer. B. New onset confusion. Rationale. New onset confusion in a COPD patient may indicate hypoxemia or hypercapnia, both signs of an acute exacerbation requiring urgent attention. Option A, 90% saturation, is within the COPD target range and not alarming. Option C, dry cough, is less specific, as productive cough is more typical in exacerbations. Option D, barrel chest, is a chronic finding, not acute. 62. A patient with COPD is prescribed salmeterol. What should the nurse teach the patient about this medication? A. Use it for immediate relief of dyspnea. B. Take it twice daily for long-term control. C. Expect weight gain as a side effect. D. Stop using it if a rash develops. Answer. B. Take it twice daily for long-term control. Rationale. Salmeterol, a long-acting beta agonist, is used twice daily to prevent symptoms, not for acute relief. Option A is incorrect as short-acting bronchodilators, e.g., albuterol, are used for immediate dyspnea. Option C is incorrect as weight gain is not a common side effect. Option D is incorrect unless the rash is severe, which requires medical consultation, not abrupt cessation. 63. The nurse is caring for a patient with COPD who reports difficulty clearing mucus. What is the best intervention? A. Encourage fluid restriction. B. Teach controlled coughing techniques. C. Administer a sedative to reduce effort. D. Decrease oxygen flow rate. Answer. B. Teach controlled coughing techniques. Rationale. Controlled coughing, such as huff coughing, helps mobilize and clear mucus effectively in COPD patients. Option A is incorrect as hydration thins mucus, aiding clearance. Option C is dangerous, as sedatives may suppress respiratory drive. Option D is irrelevant and may worsen hypoxemia. 64. A patient with COPD asks why they need a flu vaccine annually. What is the nurse's best response? A. It prevents all respiratory infections. B. It reduces the risk of flu-related exacerbations. C. It eliminates the need for antibiotics. D. It improves your lung capacity. Answer. B. It reduces the risk of flu-related exacerbations. Rationale. The flu vaccine lowers the risk of influenza, a common trigger for COPD exacerbations, by boosting immunity. Option A is incorrect as it doesn't prevent all infections. Option C is incorrect as vaccines don't replace antibiotics. Option D is incorrect as vaccines don't affect lung function directly. 65. Which finding in a patient with COPD indicates effective use of pursed lip breathing? A. Increased respiratory rate. B. Decreased dyspnea during activity. C. Louder wheezing on expiration. D. Reduced sputum production. Answer. B. Decreased dyspnea during activity. Rationale. Pursed lip breathing reduces dyspnea by maintaining airway pressure, improving exhalation, and easing breathing effort during activity. Option A, increased respiratory rate, suggests distress, not effectiveness. Option C, louder wheezing, indicates obstruction, not improvement. Option D is unrelated, as pursed lip breathing doesn't affect sputum volume. 66. The nurse is planning care for a patient with COPD. Which intervention best supports energy conservation? A. Schedule all tasks in the morning. B. Use a walker for ambulation. C. Avoid all physical activity. D. Eat large meals to boost energy. Answer. B. Use a walker for ambulation. Rationale. A walker reduces energy expenditure during ambulation, supporting mobility while conserving energy in COPD patients. Option A may lead to fatigue. Option C promotes deconditioning, worsening symptoms. Option D, large meals, can cause gastric distension, increasing dyspnea. 67. A patient with COPD is prescribed a corticosteroid inhaler. What should the nurse teach to prevent complications? A. Use it before other inhalers. B. Rinse the mouth after use. C. Take it only during exacerbations. D. Store it in a warm place. Answer. B. Rinse the mouth after use. Rationale. Rinsing the mouth after using a corticosteroid inhaler prevents oral candidiasis, a common side effect. Option A is incorrect, as bronchodilators are typically used first to open airways. Option C is incorrect, as corticosteroids are for maintenance, not just exacerbations. Option D is incorrect, as inhalers should be stored at room temperature. 68. A patient with COPD reports feeling depressed about their condition. What is the nurse's best response? A. Focus on what you can still do. B. Depression is normal, it will pass. C. Let's discuss how you're feeling. D. You should avoid thinking about it. Answer. C. Let's discuss how you're feeling. Rationale. Encouraging the patient to express feelings fosters emotional support and identifies needs for further intervention, such as counseling. Option A dismisses the patient's emotions. Option B minimizes the issue, ignoring potential clinical depression. Option D avoids addressing the patient's concern. 69. The nurse is assessing a patient with COPD for signs of right-sided heart failure. Which finding is most concerning? A. Jugular vein distension. B. Clear lung sounds. C. Heart rate of 80 beats per minute. D. Dry mucous membranes. Answer. A. Jugular vein distension. Rationale. Jugular vein distension indicates increased venous pressure, a sign of right-sided heart failure, cor pulmonale, due to chronic lung disease and COPD. Option B is normal and not concerning. Option C is within normal limits. Option D suggests dehydration, not heart failure. 70. A patient with COPD is receiving oxygen at 2 liters per minute viaduct nasal cannula. What should the nurse do to ensure safety? A. Place a no smoking sign near the patient. B. Increase the flow rate during sleep. C. Remove the cannula during meals. D. Use a humidifier only at night. Answer. A. Place a no smoking sign near the patient. Rationale. Oxygen is highly flammable, and a no smoking sign prevents fire hazards from smoking near oxygen equipment. Option B is incorrect, as flow rates require medical orders. Option C risks hypoxemia. Option D is incorrect, as humidifiers may be used continuously to prevent nasal dryness. 71. Which activity should the nurse encourage for a patient with COPD to improve respiratory muscle strength? A. Lifting heavy weights daily. B. Pursed-lip breathing exercises. C. Running short distances. D. Holding breath for 20 seconds. Answer. B. Pursed-lip breathing exercises. Rationale. Pursed-lip breathing strengthens respiratory muscles by improving exhalation efficiency and reducing air trapping. Option A is too strenuous and risks dyspnea. Option C is inappropriate due to high oxygen demand. Option D is incorrect, as breath holding may cause discomfort and isn't therapeutic. 72. A patient with COPD asks about the purpose of pulmonary function tests. What is the nurse's best response? A. They measure your heart function. B. They assess how well your lungs work. C. They check for lung infections. D. They predict your life expectancy. Answer. B. They assess how well your lungs work. Rationale. Pulmonary function tests, e.g., spirometry, measure lung capacity and airflow, assessing COPD severity and progression. Option A is incorrect, as they don't evaluate heart function. Option C is incorrect, as they don't detect infections. Option D is incorrect, as they inform treatment, not prognosis directly. 73. The nurse is caring for a patient with COPD during an exacerbation. Which oxygen delivery method is most appropriate? A. Non-rebreather mask at 15 liters per minute. B. Nasal cannula at 2 liters per minute. C. Simple face mask at 10 liters per minute. D. Venturi mask at 4 liters per minute. Answer: D. Venturi mask at 4 liters per minute. Rationale: a Venturi mask delivers precise low-flow oxygen, ideal for COPD exacerbations to avoid CO2 retention while correcting hypoxemia. Option A delivers high oxygen, risking respiratory depression. Option B may be insufficient during an exacerbation. Option C provides less precise oxygen levels. 74. A patient with COPD reports increased fatigue. What should the nurse assess first? A. Oxygen saturation level. B. Blood pressure. C. Recent meal intake. D. Sleep schedule. Answer: A. Oxygen saturation level. Rationale: fatigue in COPD is often due to hypoxemia, so assessing oxygen saturation is the priority to determine if low oxygen is the cause. Option B, blood pressure, is less directly related. Option C, meal intake, may contribute but is secondary. Option D, sleep, is relevant but not the first priority. 75. Which statement by a patient with COPD indicates understanding of infection prevention? A. I'll avoid my annual flu shot to save money. B. I'll wash my hands frequently. C. I'll stop using my inhaler during colds. D. I'll visit crowded places regularly. Answer: B. I'll wash my hands frequently. Rationale: frequent hand washing reduces the risk of respiratory infections, a key prevention strategy for COPD patients. Option A is incorrect as flu shots are essential. Option C is incorrect as inhalers should continue unless advised otherwise. Option D increases infection risk. 76. The nurse is teaching a patient with COPD about home safety. Which instruction is most important? A. Keep floors clear of clutter to prevent falls. B. Use candles for ambience. C. Store oxygen tanks near the stove. D. Avoid using a humidifier. Answer: A. Keep floors clear of clutter to prevent falls. Rationale: clearing floors prevents falls, critical for COPD patients with limited mobility and oxygen dependence. Option B is unsafe due to fire risk with oxygen. Option C is dangerous as oxygen tanks near heat sources pose a fire hazard. Option D is incorrect as humidifiers can aid mucus clearance. 77. A patient with advanced COPD expresses fear of dying during sleep. What is the nurse's best response? A. That's unlikely, so don't worry. B. Let's talk about what scares you. C. You'll feel better with more oxygen. D. Everyone feels this way at times. Answer: B. Let's talk about what scares you. Rationale: exploring the patient's fears promotes emotional support and identifies needs for palliative care or counseling, respecting their concerns. Option A dismisses the fear. Option C assumes a physical cause, without assessment. Option D minimizes the patient's unique experience. 78. The nurse is evaluating a patient with COPD using a peak flow meter. What does this device measure? A. Oxygen saturation. B. Expiratory airflow rate. C. Carbon dioxide levels. D. Respiratory muscle strength. Answer: B. Expiratory airflow rate. Rationale: a peak flow meter measures peak expiratory flow rate, indicating airway obstruction severity in COPD. Option A is incorrect as pulse oximetry measures oxygen saturation. Option C is incorrect as CO2 requires blood gas analysis. Option D is incorrect as muscle strength isn't directly measured. 79. A patient with COPD is prescribed a mucolytic agent. What is the expected outcome? A. Reduced bronchospasm. B. Thinner mucus for easier clearance. C. Increased oxygen saturation. D. Decreased respiratory rate. Answer: B. Thinner mucus for easier clearance. Rationale: mucolytics, e.g., acetylcysteine, thin mucus, aiding clearance in COPD patients with thick secretions. Option A is incorrect as bronchodilators reduce bronchospasm. Option C may occur indirectly, but isn't the primary effect. Option D is unrelated to mucolytics action. 80. The nurse is caring for a patient with COPD who is anxious about an upcoming surgery. What is the best intervention? A. Administer a sedative without consulting the provider. B. Teach slow, deep breathing techniques. C. Encourage the patient to avoid surgery. D. Increase oxygen flow to 5 liters per minute. Answer. B. Teach slow, deep breathing techniques. Rationale. Slow, deep breathing reduces anxiety and promotes relaxation without risking respiratory depression. Option A is unsafe and requires a prescription. Option C undermines medical advice. Option D is inappropriate without assessing oxygen needs, as high flow may harm COPD patients.